I'm going to give everybody a few minutes to get logged on. While we wait, I've posted a poll question to get everybody thinking about the topic today. You should be able to see it up on your screen. Please take a second to answer, and we will get started shortly. All right. Again, good afternoon, everybody. Looks like it's time for us to get started. My name is Rashida Artiega, Director of Marketing for NTC Healthcare, and I'm excited to welcome everybody today to our webinar. Thank you to everyone who answered our poll question. I'm going to go ahead and close the poll down. We will discuss those answers a little later on in our presentation. I would like to cover a few quick housekeeping items before I introduce today's presenters. So first things first, please note that a recorded version of this webinar will be available later on today. And we want this to be an interactive experience, so please feel free to shoot us your questions in the question pane throughout the course of the presentation, and we will reserve the last 15 minutes or so to address questions and comments from the audience. For those of you active on social media, please tag us using the hashtag RevCycleWeb18 to help us generate some buzz online around this topic. You can see that hashtag right here on the first slide of the presentation. So our speakers today will be offering insight into managing patient payment expectations in the best interest of patients and providers. We all know one of the most meaningful ways to improve patient experience is to make payments as effortless as possible. Our speakers today are going to offer some valuable tips on how to do just that. So without further ado, I'd like to introduce our speakers. We are pleased to welcome Janelle Wanack, Director of Business Development at InstaMed. And joining the conversation with Janelle, we have Ted Borick, Executive Vice President at NTC Healthcare. Welcome, Janelle and Ted, and thank you both for joining us today.
Thank you, Rashida, and yes, thank you everyone for participating in today's conversation.
Yes, thank you, Rashida. Look forward to participating this afternoon.
All right, so Ted, before we get started, why don't you take a minute to give a little background on NTC Healthcare and InstaMed?
Okay, thank you, Rashida. NTC Healthcare for the last 9 years has been a value-added partner for the InstaMed product. We market, train, and service their product under our trademark name of Payment Care. Elevon, a fully owned subsidiary of U.S. Bank, is our processor, and we have customers all across the country. Our clients include physician practices, surgical hospitals, large medical systems, and senior living facilities. And we do all of our training and customer service out of our Irving, Texas office. InstaMed, our healthcare partner, is the most trusted payments network connecting providers, payers, and consumers on one platform. Their rapidly growing network connects over 2/3 of the market and processes tens of billions of dollars in healthcare payments annually.
Thank you, Ted, and thank you for the invitation to participate this afternoon. Some key topics for today's discussion that I would run through an agenda real quick. We will first outline the challenges with patient collections in the healthcare industry. Why is this so difficult and what's causing the friction? Then we're going to review how providers can overcome these challenges and improve the billing process, all while ensuring their credit card data is secure. And then, of course, we've seen some success, and we want to describe how that relates to your organization. Bit of a funny here to kick things off. I'm sorry to inform you, we recommend an aggressive course of billing. Buckle up, right? So, and likely a confusing course of billing on top of all this if the experience aligns with what we see in the data. An interesting trend from the upcoming InstaMed annual healthcare report for 2017 shows that 40% of patients fear the cost of an illness more so than the illness itself. So it's not the diagnosis that's scary, it's the cost associated with that. So it really kind of launches us into the next topic of conversation here. Collecting from patients is hard for a few reasons. With healthcare costs rising, many patients struggle to pay their part. And on top of that, they oftentimes don't really understand their financial responsibility. And when you look at it from the provider perspective, there are numerous variables involved in calculating and communicating this responsibility that can be really challenging to navigate. This is indicated by the $502 billion in uncompensated care that's been provided since 2000. As the financial responsibility continues to shift towards patients, there's a need to achieve balance between providing health care and collecting for the cost of that service. Ted, in working with NTC clients and prospects, what are some of the trends that you have noticed as it relates to patient collections in the industry?
Yeah, thanks, Janelle. When we started to market the InstaMed product over 9 years ago, over 90% of income for providers came from payers. So letting a patient walk out of their facility after rendering services still allowed them to keep their doors open. Staff and patients expected the payer to cover most, if not all, of their costs. We fast forward to today, that number has declined to approximately 63% and is forecasted to be 50% to 50% by 2020. So that means that 50% of the provider's income will be coming from their patients. Many providers have not trained their staff to ask how the patient is going to pay for their services. With the average deductible now close to $3,000, this becomes a new paradigm for the patient as well. Providers cannot chase patients after services are rendered for 1 to 3 months and still expect to have a positive cash flow. Patients also have a difficult time understanding deductibles, being that high and still having to pay their providers. So these numbers don't surprise us at all. There's than what we've been seeing over the last 9 years.
Great points, Ted. And then when you stop and think about it, the process to collect a payment from the patient is really time consuming. It's not just about that initial copay. That's the easiest part. There are often multiple calls, both inbound and outbound to patients regarding collections, answering questions about the patient bill, recording payments on behalf of the patient, printing, forwarding receipts, posting the payment in at least one place, and then reconciling. So this easily adds up to 8 minutes for a single payment to be collected. And patients are so confused by their healthcare bills, as you just mentioned. First off, they don't understand the key components associated with their health insurance plan. So what does deductible versus co-insurance mean? What is an out-of-pocket maximum? And secondly, and even more difficult, they don't understand the financial component associated with these items. So, there's, especially when you involve, single individuals versus family, have I met my deductible? Is it my personal responsibility or a whole family I need to consider? And then the bills begin to come in. The do not pay this bill, the new you now owe this bill, the this is not a bill. So which do I pay? Which is accurate? Because oftentimes the amounts are different. Who am I paying this to? So bottom line, confused patients don't pay. They might call, or they might just ignore it and see what happens in the next bill. From 2010 to 2016, household bills paid by paper check declined by 20%, while electronic options increased. The reality is that paper checks are not a simple or convenient option any longer. Checkbook, envelope, stamp, post office. Who can locate both their checkbook and stamp in under 10 minutes? It's on the call. I certainly can't. The reality is, though, is this is a good thing for health systems. Checks are slower to fund. There's manual effort involved to process them, and of course, they can bounce. But the good news is half of your patients want to pay you online, which is a faster, more efficient payment channel by far than paper checks. Ted, I believe you have some interesting statistics to share associated with paper checks within your client base.
Yes, 15 years ago when we started our business, we were told that checks would probably be obsolete in 2 to 3 years. While this has not happened, we are finally seeing in healthcare the number decline in the last 6 years, as you can see by this chart. With the addition of Apple and Google Pay, the online payment portal that you mentioned, and debit cards attached to checking accounts, this trend should accelerate over the next 5 years. Our senior living facilities have witnessed this decline considerably, as you can see by a 26% decrease in check volume.
So the first step to meeting consumer demands is to understand consumer expectations of the healthcare payments process. So on this point, the data tells us that consumers do not view healthcare payments as different or distinct from payments they make in other industries. And there are innovators in other industries that provide a very streamlined payment experience. Consider the Amazon model or the Uber model and the simplicity and ease of ordering the goods or service and paying for this service. This is creating a demand for a similar experience with healthcare, one that provides great customer service, delivers on expectations, makes life easier, and offers great value. Even more so, this represents the decline in antiquated patient collection strategies and the shift to a comprehensive omni-channel payments approach. So the phrase omni-channel payments is having a bit of a moment right now. When we talk about omni-channel and improving the patient experience in healthcare, 73% of healthcare consumers want to pay all of their healthcare bills in one place. So what does this mean? It goes beyond options offered by healthcare providers and looks at creative options like consumer payments to provider through a health plan website, consumer payments to provider through online banking, and absolutely a mobile optimized experience. Primarily, the message here is that consumer choices are driven by convenience. If you make it easy, you're more likely to get paid. One thing I would challenge you with at the moment is when you consider these payment channels that patients have indicated are preferable, How many of these align with your current payment collections offering? One common denominator for consumer preference seems to be the preference to leverage electronic payment methods. When you give an option to choose various payment methods in 2016, 68% indicated they preferred to pay with an electronic method such as payment card or digital wallet. 86% prefer electronic payment methods when making a payment to their health plan. And data from the InstaMed network confirms this, also as the payment card transactions increased 120% between 2013 and 2016. All of this comes together to indicate that healthcare is primed to go paperless. So we spent the first 3 minutes of today's discussion reviewing the challenges that collecting payments from patients can represent. But what are solution options to these challenges? First step is to ensure that patients understand what they owe, because if you recall, confused patients don't pay. HFMA conducted extensive research that included focus groups among patients as well as healthcare providers, and determined that patient billing in the healthcare industry was a significant problem. So there are some key components that they outlined that are important to make sure that the healthcare financial communication focuses on. Obviously, the financial communication needs to be clear and written in a language that patients can understand. It also needs to be concise. Now, exactly what's the just right amount of detail necessary is a little bit vague, but the point being that you want to give them the information they need to understand how they got to this point in the financial transaction. Of course, they need to be correct. And lastly, it needs to be patient-friendly. So the needs of the patients and family members should be paramount when designing this particular billing piece. In addition to these key elements, the average reader should easily understand the language and format of the communication. And of course, healthcare providers should continuously strive to improve their process based on feedback from patients and consumers. So the art of patient-friendly billing is taking something that's inherently complex and presenting in a simple way. Keep in mind the 4 categories of the HFMA project. I'm going to review key elements associated with the enhanced patient bill and various components to clearly communicate with the patient. So you'll notice here, clearly display the balance. So the current total needs to be most prominent, with the details still being provided, but secondary. If you notice here on this slide, the total due is called out in 3 different spots. So in the upper right, in the lower right, and then in the dunning message is appropriate. And if you'll also notice, this account is 90 days past due, so the balance is being called out in red, as is also reflected in the color scheme of that dunning message. Ensure you establish trust. So as we mentioned, a single episode of care could result in several different healthcare bills. Make your logo and information prominent so the patient understands who they are paying. This also establishes credibility and reduces confusion. This statement can also be designed to support the color scheme of the logo if desired. So you can see here, this is a bit reflective of the InstaMed color scheme being in shades of blue. But if the healthcare organization logo and scheme reflects something differently, this can be incorporated into the patient billing design. Next is communicate relevant information. So it does seem pretty obvious, but where is the information located on your statement as it reflects some of these information? We oftentimes will find it on the back or at the last page, but make it easy for patients to locate and understand, who do I call with questions? What are my options? Is financial assistance available? These resources are all aligned in this easy-to-read section. So this leads us to step 2 in solving the challenges associated with patient collections, and it also aligns with patient expectations and preferences. Drive patients to pay online. So you'll now notice right here, big and bold, in the middle of the page, we are using this space to direct the patient to an online portal. You can see that it's eye-catching and it's clearly stating, this is where we want you to go to pay. Now this one can be controversial. Eliminate mail payments by removing the payment coupon. So think back again to consumer preferences and the decline in paper checks across industries. Many consumers don't really want to tear off the coupon, write down card information, find the stamp, etc. But when you include that envelope, when you include that tear-off slip, that's pretty much the message you're sending is how you would prefer to be paid. Now, of course, you can still offer options to pay by check. You can do it via IVR. E-checks can be processed via an online portal. And of course, you can still accept them in your practice. And if the patient really wanted to, they could still mail in a check to your organization. It's just no longer being encouraged by offering it directly with the tear-off coupon. An item we haven't touched on yet is security. So a couple of key security practices to be mindful of. First off, ensure all devices used for swiping or keying in card information are encrypted. This means no using a laptop or a computer keyboard. It's also important to ensure that your payment processor is responsible for the secure storage of any tokenized card data, whether it's received through the practice directly or through an online portal. Using a P2PE validated solution can reduce the PCI effort associated with your organization significantly. But even with security measures in place with your payment provider, it's still important to review the PCI security practices in place for your organization. Card information should not be stored in files, spreadsheets, or disposed of directly in the trash. So an added benefit of the removal of that coupon is no more mailed in, written down card numbers to manage. So step 2 is to drive patients to online tools. And step 3 will review how to make that a convenient online experience that will ultimately encourage patients to continue to use this payment vehicle. Ted, can you review how a patient's age might impact online usage?
Yeah, Janelle, this is one of the most important slides for us because we continue to see providers ignoring or not wanting to set up an online patient portal for their patients to pay them. The most common belief is that their patient population is too old and they wouldn't use an online patient payment portal. These numbers reveal that age is not a factor in offering how patients want to pay their bills easier and faster. So with many of our facilities, we have seen that either they don't have a website, don't want to pay someone to add a pay button on their website, or have not recognized that today more patients would rather pay their bill online. So again, this slide becomes critical for us in convincing our clients and our potential clients that age is not a factor.
So in offering a portal, we want to be sure to provide meaningful resources and tools to a patient. We need to allow them to enroll in e-statements and begin that migration from print. We want to be sure that they can view historical information associated with statements as well as their payment history. They can set up digital wallets for a quicker, more convenient payment process in the future. And now when they're on their mobile device, it eliminates the need to pull that card out to make a payment. And lastly, let them enroll in payment plans or automated payments to manage larger balances due. Now, this is our favorite part, success. So let's talk about some actual clients and some of the results they achieved implementing these steps. First off, what can you expect when improving the design of your patient statement? So through employing our methodology around clear, concise, correct, and patient-friendly billing, our customers are able to achieve the following results. A reduction in patient AR from 14% of total to only 2% of total in 1 year's time. In utilizing a more effective patient engagement strategy that encourages e-statement enrollment and portal usage, they were able to reduce their print and mail costs by 39% in the same time period, while simultaneously increasing brand recognition and trust using enhanced patient bill. All around encouraging results. And for our customer that removed the payment coupon, are you ready for this? So first off, what you would not expect initially, but they experienced a 15% reduction in patient calls to their call center. At the same time, they had an increase in portal usage by 20% and a reduction in paper checks by 47%. And this all occurred in just 2 months. So costs were further reduced for this organization because they eliminated the return envelope, and they also eliminated lockbox costs that they were incurring through the processing of those check payments. So when a solution costs you less and drives more payments to your organization, it's a win-win. What degree of success have we seen in association with implementing an online payment portal? Ted, I believe you've got a great customer success story that you can share here.
Yeah, as you can see from the number there, we saw for all of those clients that we signed up for a patient portal a 69% overall increase in revenue as a result of adding their online patient portal. But we've tried to emphasize with all of these clients that this is just not enough to add the payment portal. Marketing this addition is the only way to increase patient payments. The provider must put signs in their office telling their patients that this is now available. They have to add this feature, as you mentioned, to their statement. And their staff has to tell every patient who checks out with them that they have a patient payment portal on their website for them to easily go to and use. The pay button on the website has to be in a prominent, easy to find place. And they really should not put the pay button as part of the practice management's patient portal. They should have it separate on the home page.
Great. Wonderful. Okay, and thank you so much, Ted and Janelle. That was a lot of very useful information to help patients and providers get on the same page about revenue cycle. Looks like that wraps up the presentation for today. It's time for us to open the floor for questions. We have received a few already. If you haven't, please submit your questions in the question pane. Any questions we can't get to, we will certainly follow up via email. So the first question is, how can we help patients better understand their financial responsibility?
Great question. Yeah, I'll take that one. So it's a multi-tiered component, obviously. So the first element is understanding eligibility for the provider to be able to verify this information on behalf of their patient with the health plan, and then be able to communicate what that represents to the patient. Typically, we'll take an eligibility response, and then that can be utilized in providing an estimate of financial responsibility based on a broader treatment plan. So there's tools within the Payment Care platform that you can help build the treatment plan out using CPT codes to give the patient a broad understanding of what their treatment of care might look like. And then, of course, you have to have that conversation with them so that they can understand that even in putting an estimate together, there are variables that can occur that might impact what that financial responsibility might look like. And then lastly, to review their options that they have available to them in order to be able to make payment on that responsibility after treatment.
Yeah, just to follow up, Janelle, we've had tremendous success with the clients that we've brought on with your product to be able to set up installment plans. Again, as I mentioned regarding the deductibles being higher and some of the outstanding balances trying to be collected, the installment plan is automated, works extremely well, and with a credit card or an ACH, and it's something that the patient doesn't have to worry about. They can pick a date each month or each week for the payments to be taken, and an emailed receipt can be sent directly to the patient. So that's where we've had our success in that particular area.
Great. Okay, so question number 2 we have here is, what is the difference between a P2PE network and other networks? This is a security question.
Sure. So, a couple of different things here. When we talk about point-to-point encryption, we're really talking about the credit card data that's being transmitted across networks. So the kind of the starting point for that typically in a provider organization is the sort of credit card terminal or device that you're utilizing to process these transactions. So, there's a variety of terminals that are available to you on the market. The first thing you want to validate is that that device is encrypting the card data within the device. So there's some old methodology that's still that's still in place at organizations where you swipe the credit card information in the terminal, but it's not being encrypted yet. So it's kind of being transmitted over to the processor, and then once the processor receives it, we encrypt it and then finish the transmission throughout the card networks. So there's a gap right there that occurs, and that leaves the credit card information up for exposure. So you want to ensure that that device that you're kicking the transaction off with encrypts the card information inside before it sends it through the network. Very important. And then the other element is to consider is where's the card data touching your network? Are you using a homegrown system of any sort that's storing or handling credit card data? If so, you might want to consider outsourcing that to another system where they are the responsible party in terms of managing and encrypting that data as it's processed in association with various payments.
Yeah, that's great information to know. Last question that we have here is, what do you do when you have an online portal? You're already driving patients there, but nobody ever uses it.
Yeah, I think I addressed that with my last comment regarding seeing a 69% increase in patient payments through the portal. But again, the question remains that you definitely have to market that you have a portal and get patients aware that they can make their payments on your website with ease, and have that expressed within your facility and on your statements.
Yeah, great points. And if I can add just a little bit to that, you want to make sure that the options that are available within that portal are important. They're meaningful to the patient, and that it's to your point, Ted, it's easy to find where that portal is located, how they can get directed there, and if there is a requirement for them to create a login and password, that it's simple for them to be able to manage that on their own and be able to complete that financial transaction.
Agreed. Okay. Well, if there aren't any other questions, it looks like we're going to wrap it up for today. It's been a pleasure hosting you. Thank you again, Janelle and Ted, for bringing us your expertise today. Please feel free to reach out to us at info@ntctexas.com. Also, you see our website there, ntchealthcare.com, with any additional questions or comments as they come up. And please keep an eye out for the follow-up recording and slides. And thanks again, everybody, and have a great afternoon. Take care.
Wonderful. Thank you for your time and attention this afternoon.
Thank you.
Thank you, Janelle.